Hey everyone, I'm Travis Wilson, Director of Economic Development. I'm here at the Siteman Cancer Center on Graham Road with Rick Stevens and also Dr. Carl Giselle. This is Friday in the Valley of Flowers, and you know what that means, guys?
Grow with the flow.
Time to grow and flow.
You got it. It's time to grow and flow. That's exactly right. So gentlemen, let's talk a little bit about what is happening here at Siteman Cancer Center. This is a fantastic spot to have right here, and you guys are treating patients that have cancer and other things. Tell us all about it.
Well, I think it's great that we're able to bring this type of service to North County. Christian Hospital began our relationship with Siteman in July of 2017. What this means is individuals are closer to home to receive their cancer care. We have 32 chemo chairs, we have a great radiation oncology program, and then we also have a great community room where we do education with our patients as well.
Very cool. And you're involved right there at the ground level, aren't you, Doctor?
Yeah, so I'm treating patients with radiation oncology. I also have a lab that studies new immune therapies down at WashU, so it's nice to be able to come out here on Wednesdays and kind of bring some of that used to be really only available at the Siteman Main Cancer Center to kind of more of the regional site that maybe wasn't as easily accessible before.
And there are over 400 clinical trials that Siteman is participating in, which means that's bringing that back to the community and it's keeping the community healthier. So we're bringing the best medicine right here to Florissant.
And that really is important for our residents, as you mentioned earlier. They no longer have to drive downtown or drive to a different location. They can be right here in Florissant.
That's absolutely true. And what we know from the research is individuals like to be close to home for their care.
Absolutely. And that helps families too, doesn't it?
Yes, it does.
Absolutely. So what made investing in Florissant make sense for Christian Hospital?
Well, Christian Hospital has been here on the Northwest Campus since 1968. And so Florissant has been a great partner with Christian Hospital over the many years. And so why not invest in Florissant? Why not invest here? Because this is a great place to be.
I agree. And I'm sure you probably can second those thoughts.
Yeah, absolutely.
So Dr. Giselle, can you tell us what is it like for the doctors and staff to work here at Siteman, and how is that benefiting what you guys do for the patients?
You know, I think a lot of people come out here from Siteman Main Cancer Center and from WashU, and it's nice to be able to bring the therapy that used to only be available down in the main center here. So I think that brings a lot of people satisfaction that they're getting out into the community a little bit more. And you know, it's inspirational for the people who do research like myself to see the people and you know how it's affecting their families, how it's affecting their lives on a sort of more individual basis every week, and that kind of inspires me in the laboratory to figure out you know what to study and what we need to really go after next, and gives you more of a sense of urgency. So I think it's nice to be able to come out here in the community once a week at least and experience that.
It sounds like it's really benefiting and helpful. And so you all are seeing a lot of different cancer patients here with varying needs. Are you able to really take on the serious cancer patients, and what are some of the successes that you all have experienced?
Yeah, you know, we definitely have a range of cancer patients that we see, and a lot of patients who are benefiting from the newer immune therapies, you know, lung cancer, breast cancer, prostate cancer more commonly, but also a lot of the more rare cancers. And now that we have new facilities with new machines, they're kind of the more state-of-the-art machines that can handle the much more sophisticated treatments that maybe the more aggressive or rare cancers require, then we can certainly handle those. You know, I like to think about the patients who have sort of beat the odds. So I had a bladder cancer patient, for example, who saw his surgeon, and he was told that, you know, if he didn't get the cancer removed, then he had no chance of surviving, and he really didn't want to undergo surgery, wasn't really a good surgical candidate. So we treated him with the intent to cure him, and so far have been able to get rid of his cancer. He was one of those lucky people who also didn't have any side effects during treatment, so he basically felt nothing, and his cancer's gone now, and you know, hopefully that continues. So it's people like that who kind of I like to think about and who really motivate me and make me feel like those types of things are achievable for more people potentially.
It makes getting up and coming to work each day worthwhile, right?
Right, yeah, very satisfying.
Absolutely. Do you have anything to add to that, Rick?
No, I just think right now that your best medicine is right here in North County with us adding Siteman Cancer Center, and plus our affiliation with Washington University. We have 13 specialties with WashU that are at Christian Hospital. So your community, your hospital, your best medicine is right here in this community.
Well, and it sounds like you're definitely community-minded. At least that's what I'm hearing about Christian Hospital. How is it that being here in Florissant, offering that sort of care, being able to have those types of successes, sort of the big picture, how does that really help bring the community to a different level?
Well, Christian Hospital is an anchor in the community, and as being an anchor institution in the community, we have to partner with the community, and so we want the community to know what we're doing on a daily basis. And so, again, your best medicine, your community, your hospital, it's all right here. And as being an anchor institution, this really helps the community thrive, and it helps the community grow as well.
It's almost like you have a vested interest in making sure that the health of this community is doing well, right?
Oh, absolutely. When the community does well, the whole region does well.
Couldn't say it better myself. So Rick, how does the community get a hold of Siteman Cancer Center?
Well, the website is siteman.wustl.edu. The phone number is 1-800-600-3606, and we're physically located at 1255 Graham Road in Florissant, Missouri, 63031.
Perfect. Thank you so much, Rick, and thank you, Dr. DeSelm. Appreciate your time.
Thank you.
For Rick Stevens and Dr. Carl DeSelm, I'm Travis Wilson. This has been Grow and Flow. Thank you for watching.